to let your child live for one more minute.
There was a frantic effort to restore Damien's blood pressure before it damaged his heart or brain.
We gave him extra fluid intravenously. We must have given him half a liter to a liter of fluid to restore his fluid volume.
Gradually, his blood pressure increased, and Damien survived a brush with death. But the disease had only begun to reveal its power. The Heersinks agonized. What caused this terrible tragedy to happen to their son? And why wasn't there a treatment? While Damien lay near death in a pediatric intensive care unit, his father desperately searched for answers. He called an old friend from medical school who specializes in blood disorders.
John, Marnix Heersink here, from medical school?
They hadn't spoken in nearly 10 years, but Marnix was desperate.
So my personal feeling was that the doctors here are very good, but they don't see this very often.
Marnix began to describe the symptoms to his friend. But before he could finish, Dr. Kelton knew the diagnosis.
I knew what he had in 2 sentences on a telephone.
John Kelton had spent his entire career studying rare blood diseases many doctors had never seen, and he knew from his experience that the worst wasn't over.
In subsequent telephone calls, it became apparent to me, and of considerable concern to me, that Damien was moving from this localized illness called hemolytic uremic syndrome into the far more severe illness called thrombotic thrombocytopenic purpura.
Dr. Kelton knew something the local doctors did not. There was only one thing that would keep Damien alive. A risky, unproven treatment many doctors believed was too experimental. It was called a plasma exchange.
9 out of 10 people who have thrombotic thrombocytopenic purpura and are not treated will die.
The plasma exchange was a controversial recommendation. It involves completely exchanging the liquid part of the patient's blood with donated plasma.
What it is doing is washing out toxic substances from the bloodstream.
The massive transfusions would mean additional risks, a possible HIV or hepatitis infection. But Dr. Kelton knew that the greater risk was not doing anything.
I emphasized that when I've known of similar patients who did not receive treatment, they invariably worsened, and the outcome was death.
Once the daily plasma exchanges started, Damien's condition began to improve.
And I could see that, in my judgment, toxins and poisons and really awful things were being just suctioned out of his body.
Meanwhile, Mary Heersink continued to educate herself on hemolytic uremic syndrome and the bacteria that caused it.
96 to 98% of the cases of HUS are caused by this new lethal microbe exploding in our food supply.
This is the bacteria. It's called E. coli 0157. Watch, and you can see how one bacteria can multiply and become a deadly threat. Epidemiologists can trace it back only as far as the early 1970s. But it's already the leading cause of kidney failure in American children. It kills 500 people in the United States each year, most of them children. Somehow the E. coli bacteria entered Damien's system and triggered the horrible blood disorder. Damien probably ingested the deadly bacteria about a week to 10 days earlier. A single bacterium could have ignited the chain of events, wildly multiplying in the warm, moist recesses of Damien's intestines. But where did it come from? Contaminated water, meat, unpasteurized juice? And if it happened while he was on the scout camping trip, why weren't any of the other scouts infected? Before doctors knew if the plasma therapy would work, the disease struck again. An echocardiogram revealed that Damien's heart was still under attack.
They have to go in and pull off this fluid which is accumulating around his heart and, in essence, drowning him.
Now, Drastic measures would be needed to keep Damien alive. He needed more heart surgery.
If something isn't done, then the heart will eventually stop.
Was the plasma exchange started too late to halt the damage to his internal organs? His doctors and nurses weren't sure.
It was really hard. It was, because you just can't let kids die without a fight.
Damien did fight, and he survived the heart surgery. Soon, Damien started to show some improvement. The plasma exchanges continued. Damien could breathe on his own, but the disease was preparing another deadly assault on his weakened body. It started innocently enough.
He was so thirsty. He was just really dying to get some fluids in. And we started with a little bit of fluid. And then Mama went to get him some ice drink that she promised him.
When Damien took a few sips, disaster struck. An excruciating abdominal pain overwhelmed him.
And Marnix was certain at that moment that we had another catastrophe.
X-rays confirmed Marnix's worst fears. The disease had blown a hole in Damien's intestines. Poisonous bacteria were now being released into his body, and Damien would need emergency surgery.
It was the first time I think I really accepted that Damien could and would die, and you know, I had to get ready now for him to die, that this is going to be the end.
The anesthesia, the surgery, the bacteria pouring from his intestines, any one of these were enough to kill Damien.
He had very little to fight with.
You refuse to lose your hope, though, but you get this grim feeling inside, like you just don't know if you can do any more for them.
Damien's parents and his doctors didn't know if he could survive another battle. How did the deadly E. coli bacteria enter Damien Heersink? Was it from the water at Boy Scout camp, or was the bacteria in the food? And if it was something he ate at Boy Scout camp, why weren't any of the other boys sick? Surprisingly, the answer came from Damien himself. It came to him in a dream as he lay in the hospital.
It happened at Scout camp. It was my job to make the hamburger patties, and we cooked them on a grill over the campfire. We stacked them up on a tray, and I went up to the table to get one. I was really hungry, and I saw a small piece of meat on the plate. It was just a tiny piece, which looked like it fell off one of the burgers. I was so hungry that I grabbed the piece and ate it. I knew there was a problem. It was cold. It looked like it was cooked, but it was almost raw. All my friends were around. I didn't want to just spit it out in front of them, so I just swallowed it.
When Damien woke up after his dream, he told his father what happened.
But he independently came to the realization and reported it almost as a confessional to his dad that, I know it made me sick, Dad. It was when I swallowed that. I knew that was wrong. Something was wrong about that. That's what made me sick.
Thoroughly cooking hamburger usually kills the E. coli bacteria. But since Damien ate a piece of rare meat, the E. coli bacteria were multiplying inside his system within minutes of ingestion. By the time Damien left for space camp a week later, the E. coli bacteria had begun to produce toxins which attacked his vital organs. Ironically, the medicine Damien took to relieve his diarrhea during the trip probably made his condition worse because it hindered his body's attempt to flush the bacteria from his system. Fortunately for Damien, the experimental plasma exchange worked. It saved his life by removing the deadly toxins from his bloodstream. After 5 weeks in intensive care, 7 operations, and many agonizing brushes with death, Damien survived his war against the deadly E. coli bacteria.
At the same camping trip that Damien was on, other children ate the same food. It only happened to him. Why did it happen to him? Well, the answer on a trivial level is that it was fate, but obviously there is something in certain individuals that put them at risk of having this reaction.
It's pretty scary. just whenever I get a chance to think about it and think about everything that happened to me.